Indonesia's COVID-19 restrictions will likely be extended as cases continue to spike. The country has seen a record jump in daily deaths, with more than 1,000 fatalities. New infections have topped 54,000, taking the country's tally past 2.7 million. Indonesia has overtaken India as Asia's new coronavirus epicenter. While curbs were due to end on Tuesday, officials say they are struggling to control the spread of a Delta variant outbreak. The government is considering extending restrictions to more provinces and cities outside of Java and Bali. Hospitals have been overwhelmed by the surge in patients. With few beds available, many have been dying alone at home. Authorities have started distributing free medicine packs to support patients that are isolating at home. Now, the Philippines has detected its first local case of the Delta variant. Authorities are on high alert with stricter curbs reimposed in some areas. 11 people have been locally infected with the more infectious strain. One of them has died after being hospitalized in densely packed Manila. Authorities are investigating if the virus has spread within the community. There are concerns over a possible explosion in cases. Officials say contact tracing has been expanded. They are urging people not to gather. The government will reallocate more vaccines to regions with Delta variant cases. It says the jabs help prevent those infected from developing severe cases of the disease. The country's vaccine rollout has been sluggish. Fewer than 4% of its 110 million population has been fully immunized.
The Australian state of Victoria has reported 6 new COVID-19 infections on day 1 of a 5-day snap lockdown. At the same time, infections are surging in neighbouring New South Wales. There are 97 new local cases, the bulk in Sydney. People are again being urged to follow the rules.
I know and understand that this is not easy. No one wants to be locked down, but we had no choice, and these additional cases overnight, and particularly some of the context to these cases, I think confirm for all Victorians that we had to make that tough call. We have been here before, we have done this before, and we've done it with Delta.
At least 100 exposure sites have been identified across Victoria. Melbourne accounts for the majority of them. Authorities believe the virus spread from Sydney's Delta clusters. Now, 40% of the country's 25 million population are currently living under some form of lockdown. Let's take a closer look now at the COVID situation in Asia. Dr. Bharat Pankhania from the University of Exeter joins us live. Dr. Pankhania, the Delta variant sweeping across this very large region. Could countries have done more to prepare?
Unfortunately, the Delta variant is more infectious. It's 3 to 4 times more infectious, and therefore it is catching people off guard. The only things that we can do is a multiple layer of infection control measures. No one infection control measure works. So you need to wear a mask, but you need to wear a better quality mask and wear it properly. And the other bit that really helps is immunize. But unfortunately, with respect to immunization, you haven't got the supplies of the vaccines to immunize as many people as possible, as fast as possible. So you are in a difficult situation.
Lockdowns are currently in place across Asia, but cases continue to skyrocket. You've just laid out things that should be done in order to sort of curb this, but it's clear to see that, these things are not being done across the board.
Indeed, and you see, we always are led by politicians to think tomorrow will be a good day. And my answer would be, good days will arrive, but not tomorrow. And therefore, in the meantime, we have to maintain the infection prevention measures that we can do. And the one that we can do is avoid crowds, avoid closed, poorly ventilated places, avoid getting close to other people that are not in your network. And my advice, I have changed my advice from ordinary surgical mask to wear a higher quality FFP2 mask, because the Delta variant is 3 to 4 times more infectious. And as soon as you can, get your vaccine. But I appreciate that you can only vaccinate when a vaccine is available.
Well, we've seen a renewed round of lockdowns and tighter restrictions across parts of the region. What do you anticipate the impacts of those being?
Unfortunately, there is also lockdown fatigue at play. And if people are not kept, compliant, we will find more and more people are refusing to comply, and then you will get more and more cases. So the implications are that if you don't play this right, you will lose control with regards to managing the number of cases that you have, because this is much more infectious. So really good messaging, important sensitive messaging, and measured actions are the only things you can do in the absence of not having the vaccines.
How optimistic are you that we're going to be able to get through this here in Asia? As you mentioned, a lot of the things that you are sort of alluding to just don't seem to be taking place.
It is a pity, because there's a lot of cultural things, and there's also a lot of pressure from businesses to have business continuity. And my advice to businesses who are rightly complaining is sort out the health, and you will sort out the businesses at the same time. It isn't a case of one against the other. The health and the economy can be sorted out, but sorted out in partnership. And really, it is important for public health doctors, public health clinicians, and other clinicians to take the lead in advising the public about how to keep safe. And the one way to keep safe, it really is not rocket science, is those 3 C's that I mentioned. Wear that mask, wear a good quality mask, wear it properly, get immunized. There is nothing else we can do.
All right, many thanks for your thoughts this evening. Dr. Bharat Pankhania from the University of Exeter.